Hi everyone, welcome back to my channel. This is Dr. Nakubiana Mufaya Siameka, or you can just call me Dr. Mufaya. To those that are tuning in for the first time, you are most welcome and thank you for coming through. In my previous video, I talked about how I'm starting a 5-part series talking about diabetes. Thank you all for watching and sharing and liking my video. So in this video, I will talk mostly on what diabetes is, the types of diabetes, the symptoms, and how the doctor is going to know that you have diabetes once you go to the hospital, how it's diagnosed. So what is diabetes? Diabetes is a metabolic syndrome where your body is not producing enough insulin or no insulin at all, or the body is not utilizing the insulin that you are producing, thereby causing an increase in your blood sugar levels. What are the types of diabetes? There are two major types, and that's type 1 and type 2. In type 1, your body cells, the cells that produce insulin, are being attacked and being destroyed by the body itself. That's how you end up with type 1 diabetes. Then type 2 diabetes is where your body is producing insulin, but your cells, your muscle cells, are not utilizing that insulin to take up the glucose. Therefore, you end up with high blood sugar even when you have insulin in your body. So in type 1, of course, because you don't have enough insulin or you don't have insulin at all in your body, the doctor will need to give you insulin. So we give type 1 patients insulin, while as type 2 patients, usually because the body is not utilizing the insulin, they will end up on medication tablets that will facilitate the uptake of glucose from the blood into the body. Those are the two major types of diabetes. So apart from type 1 and type 2 diabetes, there are other forms of diabetes. Before I go to those, I would like to say that I will get into more detail about type 1 and type 2 in my next video. So there are other types of diabetes like maturity onset diabetes of the young, or MODY, and this one really affects young people, and I'll explain more about this when I'll be explaining about the types of diabetes. There are so many other causes of diabetes apart from your type 1 and your major type 2. Some of the other causes would be an infection. If someone has an infection that's affecting the pancreas, that might lead to reduced insulin. Apart from that, it could be because somebody had a pancreatectomy, where a part of the pancreas was removed during surgery because maybe they had a tumor or some other condition, mostly tumors. Part of the pancreas has been removed, and so it's not producing insulin as much as it would. Another cause of diabetes is drugs like glucocorticoids or thyroid replacement hormones. They affect how the body functions. Other drugs would be epileptic drugs. So if you are on certain medications, you can ask your doctor. So those are some of the causes of diabetes. How will the doctor know that you have diabetes or you're diabetic when you go to the hospital? So mostly they would do a test known as the fasting blood sugar test, and this test is done at least 8 hours after your last meal. After taking your last meal, which is your supper, your doctor will advise you not to take anything else until the following day when the test is done. So you take your supper and don't eat anything, don't eat breakfast, you go to the hospital, get your blood sugar checked, and that's your fasting blood sugar. If your blood sugar is more than 7 millimoles per liter or more than 126 milligrams per deciliter, then you'll be told that you are diabetic. Of course, this should not just be a once-off reading. So another test that can be done is random blood sugar. Random blood sugar is done at any time during the day. That's why it's called random blood sugar. So when your random blood sugar is more than 11 millimoles per liter or more than 198 milligrams per deciliter, then you are considered to be diabetic. Another test that is done at mostly in the Western world or in developed countries. In Zambia here, I haven't recently been done, so I don't know if it's done anywhere. But there is a test called oral glucose clearance test, or GTT. So this is a test where they'll give you a sugar solution, you drink, and 2 hours later they'll test how much sugar you have. If that value is more than 11 millimoles per liter or 198 milligrams per deciliter, then you are considered to be diabetic. So you don't really need to memorize these values, but it's good to know. This is good for you to know. In case you go to the hospital, you can always ask your doctor to explain to you what your blood sugar level means and what you can do about it. So those are some of the tests or ways in which the doctors will know that your sugar is high. It's a very simple test that is done. It's just a prick of a finger. You prick your finger and the test is done in less than 1 minute. You have your results. So I would advise that you all go and get tested just to make sure that you're not diabetic. So you might ask to say, what are the symptoms or signs that somebody is diabetic? The major symptoms that we look out for is polyuria, polydipsia, polyphagia. Polyuria is urinating too much, polydipsia is drinking too much water, and polyphagia is eating more than you usually would. Now, I'm not saying that just because you are urinating too much, it can be a symptom for other conditions like UTI. Do not get so much worried and thinking, oh, I'm not diabetic, it may be something else. So just go to the hospital, talk to the doctor, and they will be able to help you. That brings us to the end of this video. I hope you have learned something. Like my video, share with your friends, subscribe to my channel. You can also like our Facebook page. It's Dr. Nakubiana Mufaya Siameka. This is the end of the video. I hope it's been educative. Look out for my next videos. If you have any questions, please leave them in the comment section, because I will do a specific video where I'll answer your questions. So be sure to do that. Until next time, it's bye.